Hello, my name is Dr. Charles Modlin. Welcome to another edition of Dr. Charles Modlin Speaks, a forum where I speak about a variety of important topics and issues that I feel are necessary to be brought to the attention of our nation. Today, in this forum, I am going to be speaking about the imperative of diversity, equity, and inclusion in the health professions. I'm a kidney transplant surgeon and a urologist, and for over 30 years I've also been a notable, visible, innovative, and transformative national leader for the elimination of health disparities and health inequities that disproportionately afflict and burden African Americans. These health inequities, with the rapidly growing diversification of our nation to where minority populations will soon become the majority percentage population, represent a growing national crisis state that all sectors of our society, of our nation, must seriously and swiftly address. We must stop just talking about health disparities and stop collecting just more data about the social determinants of health. We all know the data on social and societal determinants and drivers of health has been out there for decades. Instead, we must devote our institutional resources on developing and implementing substantive and innovative best hands-on clinical practice and health policy initiatives that will allow us to more effectively engage, empower, promote access to care, and deliver care that is culturally relevant to populations that are higher risk for developing and dying as a result of health disparities and health inequities. Perhaps you may have seen or heard some of my previous presentations on health disparities and inequities. If you have not, I encourage you to access some of my archive materials, and I invite you to follow me on LinkedIn and on my Dr. Charles Modlin Health Equity YouTube page, like, share, and subscribe, and on X and on my website, drmodlinmd.com, to view my previous discussions and presentations on health disparities and health inequities. You can also follow my podcast entitled Music and Medicine on Facebook, LinkedIn, and on Spotify. But today I come before you to address a matter of utmost importance and urgency, one that not only impacts the health of individuals, but also the very fabric of our society. The critical role and imperative of diversity, equity, and inclusion, DEI, in the health professions. As I said, the elimination of health disparities and health inequities is not merely an aspiration, it is a necessity. The overall role of diversity, equity, and inclusion in our workplaces, educational sectors, within our institutions, and in our society as a whole, at the present time has been questioned and is under scrutiny. However, here before you now I sit to emphasize that diversity, equity, and inclusion in our health professions is critical for the very sustainability of our society, and D&I in healthcare is not optional, it's not a luxury, it is life-saving. Let us first reflect upon a painful chapter in our nation's history of which we all must become aware and acknowledge, which substantially has played a role and explains how we got to where we are in this nation today with respect to health disparities and inequities that exist, are perpetuated, and remain pervasive. And that is the Tuskegee syphilis experiment. Beginning back in 1932, this infamous study involved the unethical treatment of African American men in Alabama who were misled and denied treatment for syphilis even after penicillin became a standard cure in the 1940s. The participants were left untreated for decades, all in the name of research. This betrayal established a deep-rooted distrust of medical institutions among African Americans. It's been a sentiment that has been passed down through several generations. The historical context of distrust is a vital understanding as to why many African Americans, particularly black men, are reluctant to seek preventative health care services, and why many blacks are reluctant and resistant to participating in clinical medical research trials, in which participation of black patients is critical to advance the science of medicine and to develop new medications and treatments that are more effective in black populations. It's become clear that in many instances when there is diversity on the clinical research team, and in particular when there is diversity in the research coordinators who approach African American patients to explain the purpose of the research study, the study design, and to ask them for their consent in enrolling in the clinical research trial, that this leads to a greater acceptance rate of African Americans willing to enroll in the clinical research trial studies. This distrust has dire consequences. Studies show that black men are more likely to present with advanced stage prostate cancer compared to their white male counterparts, largely due to delayed screenings. In fact, the life expectancy for black men in the United States is about 6 years shorter than that of white men, an alarming statistics that reflects a broader pattern of health disparities. When we examine the life expectancy of black women, we find a similar narrative. Black women live on average about 4 years less than their white female counterparts. According to the CDC, black women are 4.5 times more likely to die from pregnancy-related complications than white women. These disparities are not merely numbers. They represent real lives affected by systemic inequalities. Health disparities arise from a multitude of causes, including social determinants of health. Factors such as socioeconomic status, access to health care, education, and living conditions. The social determinants create an environment where health inequities thrive. For instance, neighborhoods with limited access to fresh food, safe parks, and quality schools contribute to poorer health outcomes. In certain disease states, hereditary and genetic predeterminants also contribute to observed health disparities, such as twice the incidence and twice the death rate of prostate cancer in black men compared to their white male counterparts. This contribution of hereditary and genetic predisposition towards disease underscores the importance that everyone, whenever possible, should take steps to become aware of their own family medical histories. So to combat these healthcare disparities, we must prioritize DEI in the health professions. Increasing the representation of African Americans and people of color in the medical, nursing, and other healthcare fields is critical. It's crucial. Currently, only about 4 to 5% of physicians in the United States identify as black, and the percentage of Hispanic doctors is similarly low. This lack of representation does send a message to minority communities that their health and well-being are not a priority. In addition, it is well known that black doctors are commonly the ones most likely to return to and provide medical care and health education to black communities. And as I said, many African Americans do gravitate towards, trust, and depend upon the guidance and advice of black doctors to advise them and help in directing their medical care. I, as a black physician and surgeon for nearly 40 years now, can clearly attest to and assert this as factual, and I have endless testimonials to this effect. Please allow me to go into more detail and to be more clear and precise with respect to the life-saving imperative of diversity, equity, and inclusion in the health professions. First, let's discuss the importance of cultural competency and implicit bias training for all healthcare professionals, and why a commitment to diversity, equity, and inclusion, DEI in medicine, are fundamental components that can and do significantly improve health outcomes, particularly for black patients and underserved communities. So here's how these elements work together to promote better health outcomes. We talk about cultural competency and cultural competency training. So cultural competency refers to the ability of healthcare providers to understand, to communicate with, and effectively interact with patients from diverse cultural backgrounds, different from their own. This competency enhances health outcomes in several ways. It leads to improved patient and provider communication. Cultural competency training equips healthcare providers with the tools to communicate effectively with patients who may have different cultural beliefs, values, and health practices. This enhances understanding and encourages an open dialogue, leading to better patient engagement and adherence to treatment plans. Cultural competency leads to improved tailored healthcare interventions. For example, providers who understand cultural differences can tailor their healthcare interventions to align with the patient's values and beliefs. For example, dietary recommendations can and may be made more relevant when they consider the cultural dietary practices of their patient, increasing the likelihood of adherence to lifestyle changes. Of note, I have highlighted in previous presentations that the fact that there are clinical recommendations as to the onset and timing of preventative health screenings for individuals based upon their race. For example, black men, because of their higher incidence and propensity to developing and dying from prostate cancer, should start screening for prostate cancer at the age of 40 years old versus at the age of 55 years old in white men, unless they themselves have a strong family history of prostate cancer. Cultural competency leads to improved trust. When patients feel that their cultural backgrounds are understood and respected, trust in the healthcare system and the providers increases. You see, trust is a crucial factor in patients seeking care, following treatment recommendations, and sharing their pertinent health information with their providers. Implicit bias training is also very important. Implicit biases are unconscious attitudes or stereotypes that can affect understanding, actions and decisions in an unconscious manner. Training healthcare providers to recognize and address their implicit biases can and does lead to improved health outcomes. It leads to a reduction in disparities in treatment. Implicit bias training helps providers become more aware of their potential biases and encourage them to approach each patient as an individual rather than as a representation of a certain group. This is particularly important in reducing disparities in treatment that can occur based on race or ethnicity. Implicit bias training also leads to enhanced diagnostic accuracy. By mitigating biases in healthcare, providers are more likely to make accurate diagnoses and provide appropriate treatments regardless of a patient's race or background. This is vital for conditions that disproportionately affect Black patients, such as hypertension and diabetes, prostate cancer, breast cancer, mental health concerns, and other conditions. Diversity, equity, and inclusion. How does that play a role in improving health outcomes? Well, diversity, equity, and inclusion in healthcare settings fosters an environment where all voices are heard and valued. This commitment has several benefits. DEI in healthcare leads to increased representation. Matters such as when there is a diverse healthcare workforce, it's more likely to include providers who understand and relate to the lived experiences of Black patients. This representation can lead to increased trust, better communication, and more effective patient-provider relationships. DEI in healthcare leads to a greater holistic approach in treating their patients and community partnerships and collaborations. A diverse group of healthcare professionals brings a variety of perspectives and experiences to the table, leading to more comprehensive and holistic approaches to patient care. This can be especially beneficial in addressing the social determinants of health that impact Black communities. The subject of racial concordance and DEI. So racial concordance refers to the alignment of racial or ethnic backgrounds between patients and their healthcare providers. This concept of racial concordance has a profound implications for improving health outcomes. It leads to improved communication, health literacy, and understanding between providers and patients. Studies have shown that patients were more likely to communicate openly with providers who share similar racial or ethnic backgrounds. This can lead to more accurate health assessments and tailored health interventions. Racial concordance in healthcare and DEI leads to higher patient satisfaction. Patients often report higher satisfaction rates and a greater sense of comfort when treated by providers who share their racial or ethnic background. As we know, higher satisfaction can lead to increased patient adherence to treatment plans and follow-up care. Ultimately, DEI in healthcare leads to better health outcomes. Research indicates that racial concordance can lead to better health outcomes for Black patients, including improved management of chronic disease states, higher rates of preventative care, adherence to treatment recommendations, and lower hospitalization rates. So to drive it home, racial concordance between patients and their healthcare providers has been shown to improve communication, understanding, and compliance with treatment recommendations. When patients see providers who reflect their racial and cultural backgrounds, they are more likely to engage in their health care, leading to improved health outcomes. This is not to suggest in any way, shape, or form that white or other racial or ethnic healthcare providers cannot serve Black patients, but rather it serves to highlight the importance of building trust, breaking down barriers, and empowering Black patients and communities to take control over their own health. Seeing more Black doctors is also inspirational for many Black youth to see, as it serves to also stimulate and motivate them in pursuing careers in the STEM professions and the health professions. Black doctors historically have been active in mentoring the younger generations to encourage them to enter the STEM professions and the health professions. Now, the pushback against DEI that we've recently seen in the pushback against DEI initiatives in healthcare and education, among other sectors, is a situation that all of us, including our political leaders and our policymakers in our federal, state, and local governments and corporate and community and philanthropic sectors, must also be concerned and quite literally terrified about. No part of our society can afford any longer to ignore the data. And the data on health disparities is the fact that health disparities cost our nation over $480 billion annually. As our society continues to diversify, minorities are projected to become the majority. If we do not address these disparities now, we would not only jeopardize the health of our nation, our entire nation, but overall viability and sustainability and existence of all aspects of our nation as we know it. The crisis of health disparities is one that demands urgent attention from policymakers, healthcare providers, academic researchers, community leaders, spiritual advisors, as well as the corporate and philanthropic sectors. Initiatives like the Cleveland Clinic Minority Men's Health Fair, open to all and inclusive of all regardless of their race, gender, and ethnicity or persuasions, which I established back in 2003 and which was facilitated by thousands of my caregiver colleagues over the many years in which I implemented at Metro Health in Cleveland in 2022, serves as a beacon of hope. It serves as a best practice to promote access to care and build and improve trusting relationships between healthcare providers and minority communities. Programs such as these should be sustained, supported, adopted, and implemented nationwide. Such programs engage communities, promote health literacy, and empower individuals to take charge of their own health. My colleagues and I are implementing additional hands-on best practice clinical care programming, which you will hear me discuss in the future. Programs that will also serve as best practice to substantively help us solve the escalating health disparity crisis state in which our nation finds itself. So, in closing, I urge each of you to join me in spreading awareness about the health disparity crisis and that the imperative of diversity, equity, and inclusion in the health professions is a vital part of the solution and equation for our nation to overcome this health disparity crisis that is increasingly threatening the very existence of life as we know it in our great nation. Diversity in the healthcare professions, as I have clearly outlined, is a vital component that will allow all sectors of our society to work together collectively to foster environments of trust, increase health literacy, and empower individuals to seek preventative care to prevent and control in early stages these health disparities that plague and soon will bankrupt and destroy the very fabric of our nation. These health disparities are unsustainable, but together we can create a future where health equity is not just a goal, but a reality for all. So in conclusion, cultural competency and implicit bias training for all healthcare providers are essential for providing the quality of care that Black patients and all patients deserve. Commitment to diversity, equity, and inclusion, along with fostering racial concordance in patient-provider relationships, creates an environment that enhances communication, trust, cultural understanding. These elements are critical in addressing health disparities and promoting better health outcomes in Black and brown patients and underserved communities. As we continue to advocate for health equity, it is imperative that health institutions prioritize these initiatives to ensure that all patients receive the quality of care that they do deserve. Diversification in our health professions when it comes to empowering, preparing, and training, in particular more African American physicians and healthcare professionals, is a subject of its own which is replete with significant challenges rooted in the historical context, which time does not allow me to discuss in this session. But it is a subject that I will highlight and outline for you in coming weeks. So I look forward to receiving your thoughts, comments, and feedback. You can reach out to me on my website, drmodlinmd.com, or email me at drcharlesmodlin@gmail.com with your comments and with your interest in joining me in raising awareness to the nation about this growing health disparities crisis. Let me know of your interest in working with me to develop and define and implement substantive solutions to this health disparities crisis. The time has come for us collectively to stop just talking about the problem and to start taking substantive action steps to mitigate these devastating health disparities. As my father would always say in closing then to each and every one of you, may each and every one of you continue to be blessed, and until next time, stay safe.